Thank you, Denise and Beneo, for sponsoring the lunch session. So as you all actively feed your gut microbiome, I'm going to talk to you about the gut microbiome and specifically about prebiotics and their role in feeding a healthy gut microbiome. Just my disclosure. And just to very quickly review the objectives, which you'll have in your slide packs, but really to understand, first of all, the importance of the gut microbiota in health and in disease. And I'm going to try and span across the lifespan to examine the potential for dietary factors, including prebiotics, to modify the gut microbiota, and to highlight clinical and public health applications of prebiotics for chronic disease management. So we've all heard the term, the gut microbiome or gut microbiota, and really it encompasses all of the microorganisms that are found within the gut. And most of the research and most of our understanding to date really comes from the bacterial component of that ecosystem in the gut. But it's important to realize that it also, when we say gut microbiota, it also includes the viruses, the yeast that are found in the gut, and archaea. And of all of those, probably besides the bacteria, the one that's getting the most attention now is the fungus, the fungi, and so some of the yeast, and what is their role to play in health, but also in causing disease. So when we think about this community of microorganisms that live in the gut, there's 39 trillion of them in an average individual. And interestingly, they have if you think about all of the genes that the microbes have, there's about 1,000-fold more than we have human genes. So we have about 23,000 human genes. There's 1,000-fold more microbial genes. So that's a lot of potential for them to have functions that can benefit us as humans. About 1,000 different species have been identified in the gut. But if we were to take a sample from majority of us in the room here and we were to actually see how many does each person have, it's about 160 species. So we can identify many, and you can tell why there would be a lot of variation across individuals, but each of us has about 160 species of bacteria. Now, the key thing, and we talk a lot about what is a healthy microbiome. Let's feed the healthy microbiome. But it's difficult to define that. And it's been very challenging because you can have multiple individuals who are very healthy, eat very different or have very different bacteria that make up a healthy microbiome, and yet they're all defined as healthy. So we can't pinpoint that. But there's a few characteristics of that healthy microbiome. So first of all, resistance. Can it resist perturbations, things that come at it? Is it resilient? So if you, for instance, have to go on to antibiotics, is your microbiome resilient to come back to the state it was before? Very important for health. And is it stable? And by the time we're about 3 years old is when we increase the microbiome stability quite substantially as an individual. It's very unstable, it's fluctuating a lot, but as you get to 3 years of age and then right on into adulthood, it really should become a very stable ecosystem. So the microbiota does a lot of things for us as the host. Very importantly, it harvests energy from dietary fibers. So as you all know, we don't have the enzymes to digest it, but think of those 1,000-fold more genes that the microbiome has than we have. A lot of those genes are used to break down these fibers and products that we as humans cannot. They produce vitamins for us, so the B vitamins and vitamin K are produced by the gut microbiome. They can suppress the growth of pathogens, so harmful bacteria that we don't want to get out of control in their growth. They can suppress those. It can affect mood, so there's a lot of interest in the gut-brain axis, and we know that the microbes can actually play a role in that, and we'll talk a little bit about anxiety and depression a little bit later on. They can metabolize drugs, so the microbiome in the gut can activate drugs or deactivate drugs. Really, really critical function is training the immune system. And this is incredibly important in infancy. And I've got a couple really interesting examples of how the microbiome works to make sure the immune system gets trained up properly. And then the intestinal barrier and just gut motility. Now, something that has emerged from the research that I think is going to eventually come into practical application and maybe clinical practice one day, is that what your microbiome profile is right now before you would start an intervention or something really has the ability to predict or even dictate whether or not you're going to respond to a diet intervention or a medication or something. So there's some interesting examples that have been shown in the research. So first of all, the baseline gut microbiota, so what you currently have as a microbiome profile, can predict weight loss in response to dietary intervention. So whether you're going to be a responder or a non-responder to a diet can be predicted based on what are those 160 species that you have in the gut presently. Very interesting in terms of cancer treatment. There's a lot of research, very interesting research going on in the world of gut microbiome and cancer therapeutics, and an individual's response to chemotherapy and immunotherapy are in part dictated by what is their baseline microbiome. And then non-responder, responder to the development of glucose intolerance with certain artificial sweeteners. So there's some interesting research emerging there that some of the artificial sweeteners could possibly increase glucose intolerance, but it was completely dependent on what was the baseline microbiota of those individuals. So it wasn't seen across the board in individuals. So of all these wonderful things that the microbiome does for us and really promotes our health, there can be disruptions to the microbiome development early in life, and this can then lead to disease in later life. So that early period of life is really critical for this establishment. So what are some of these factors that dictate the establishment of the gut microbiota? First of all, maternal factors. So what is mother's diet during pregnancy and lactation? What is her weight status? Normal weight, overweight, obesity can all affect the microbiome of the mom. The delivery mode, so we know there's a very big difference between the gut microbiota of an infant who is delivered vaginally versus one that is delivered via C-section. And by C-section, the initial colonizers or the initial bacteria that infant is going to be exposed to really resemble more skin bacteria and hospital or environment bacteria, whereas the infant born vaginally is going to be exposed to mother's vaginal microbiome. And those can have lasting effects on infant health. And then the other one that can affect mom's microbiome is psychological stress. And again, there's more work looking at how can, this gut-brain axis, how can stress actually alter the microbiome, and then that can be passed on to, or be the first exposure of the infant to maternal microbiota. Once an infant is born, we know that human milk, one of the third most abundant component of human breast milk is human milk oligosaccharides. And these are very important in feeding the microbiome of that infant, the development. And they actually have prebiotic properties. So they target the healthy bacteria resident in that infant's gut, and they make them bloom. And you can have very, very high, an exclusively breastfed infant, up to 90% of all of their bacteria could be bifidobacteria because of these human milk oligosaccharides. We call them HMOs. This can be in contrast to infant formula, so always, of course, striving for breastfeeding, but sometimes we need infant formula, and so we do see differences in how this affects the microbiome, and maybe there's things to be added to the infant formula to get them closer to a microbiome of an exclusively breastfed infant. Antibiotics. So some very interesting work showing that if mom has to take antibiotics during pregnancy, or even if mom only has to have antibiotics in the intrapartum period, so only during delivery. So you might have this for C-section, very often C-section, they will also give antibiotics, or also for group B strep. Those antibiotics are used prophylactically. So there's research in infants showing that just that very brief exposure of antibiotics during delivery, the intrapartum period, can affect what you see for microbiome in that infant. So we really want to be, careful with antibiotic use, obviously life-saving drugs, but they can have lasting impacts. And then does the infant itself have to take antibiotics? And then family size, you have lots of siblings, pets, all of these things can increase your exposure to microbes and increase the diversity of bacteria that you are exposed to. So many factors that establish the gut microbiota. So I want to just give you two examples of how that microbiota is so critical for training the immune system and some of the lasting effects it can have on the immune system, and particularly immune-mediated disease. So if we think about Finland, it has the highest rate of type 1 diabetes in the world, and just across the border in the Karelia region of Russia, they have 8 times lower incidence. So what we know about these two areas is they share very similar genes, very similar language, because at times the borders have shifted there, so very common in many ways, but vastly different hygiene practices and microbial exposure. So particularly antibiotics in early life, much, much higher use in Finland. And so what the thinking is that there's certain bacteria, again, I'm going to talk about bifidobacteria a lot in the talk, is that when present in early life can strengthen the immune response and prevent type 1 diabetes. So this early exposure to microbes is really critical for this long-term trajectory of preventing disease, and in this case, particularly type 1 diabetes. Now, one other really cool study that I thought was published in 2022, they looked at other exposures. So quite a bit has been done with antibiotics, but this was a sandbox study. So there's a hypothesis that if we have poor exposure to environmental microbiota, so all microbiota in our environment, this is one of the key factors that predisposes us to immune-mediated diseases, so more allergies, more autoimmunity, more inflammatory bowel disease, if we don't have enough exposure to microbes throughout our life, and particularly when we are infants and children. So they did a Finland daycare study, and they had children aged 3 to 5 years, and they split them up, and some of the kids got playground sand that had been enriched with microbial diverse soil. So they mixed in the bacteria-rich soil, and the other kids got the placebo sand. And so twice a day, 20 minutes a day, they would go and play in the sandbox, and they just did it for 2 weeks. And what they saw was that the microbiota on the skin of the children who played in the enriched sand, that their skin microbiota became to resemble the microbiota of that soil that they mixed in there. And when they looked at immune parameters then in those children, they saw that just after 2 weeks, just that bit of playing in the sand, they had a more anti-inflammatory immune response within the body. So it's just, such a clear research-driven example of, yes, we need microbial exposure. Here it's with, hands and skin, but we need to feed our microbiota. We need to be exposed to microbes to have a healthy immune response throughout life. So lots of things that the microbiome does for us in terms of health, short-term and long-term, but we've also heard that we can have dysbiosis or an imbalance, and this can be linked to disease. And there's lots of diseases that have been linked to disruptions in the gut microbiome, but I just want to highlight 3 here. So the first one is actually the very first indication or condition where they saw that the microbiome could be involved in human health in a very clear way. And in this study, it was in mice. They took the fecal matter from an animal with obesity and they transplanted it. Orally is the way they do that. So orally, they give that fecal sample to the lean mouse, and the lean mouse gained weight and it gained body fat. This triggered the entire field, really, of gut microbiota. And so what then other studies and other diseases and conditions soon began to investigate, is there a linkage between the microbiome and other diseases? So 2 other examples I just want to briefly share with you. A fecal microbiota transplant, so they took the fecal matter, in this case a human, so a stool sample, from a patient who had colorectal cancer, and they transplanted that into a mouse, a germ-free mouse. So these mice are raised completely sterile, so they have no bacteria, no viruses, nothing. So the only thing that is being given to this mouse is the stool sample from the patient with colorectal cancer. And what they saw was that when you stimulate tumors then in those animals, those who got the fecal microbiota transplant had increased tumor incidence. So it was the only thing that was different, the only thing, and that microbiota could transfer this increased susceptibility to tumor incidence. And then the last example here is fecal microbiota transplant, again from humans into these mice to show this effect of the microbiota, was with major depressive disorder, could induce in these mice again depression-like behaviors in the mice who received that. So it just really is such a powerful way to demonstrate that our microbiome, lots of healthy functions that it does for us, but when it's disrupted, it can really trigger a host of very severe conditions. So how do we then make sure that our microbiome is as healthy as it possibly can be? And diet is actually one of the most important modifiers of our gut microbiota. And out of all the foods that could possibly feed the microbiota, dietary fiber is the most critical fuel for feeding that microbiome. And if we think about what the dietary fiber does, is it gets fermented by those bacteria into short-chain fatty acids. So we have 3 short-chain fatty acids that are chiefly produced, so acetate, propionate, and butyrate. And these are really important for the health of our gut. So butyrate specifically is a very important fuel for our colonocytes. And the intestine requires a lot of energy. As the cells turn over, butyrate is one that fuels them and keeps them in a healthy state. We also know that these short-chain fatty acids that are produced directly from the dietary fiber being fermented is to improve the absorption of dietary minerals, such as calcium. Another very critical function is to enhance the intestinal barrier. So we hear a lot about leaky gut these days. So what is that an accurate term, or what is this? So we know we have an intestinal barrier where the intestinal cells should be fairly tightly linked together, and you shouldn't have molecules traveling through them, or bacteria things. And these tight junctions can be enhanced through short-chain fatty acids. We also have a very nice mucus layer that lines our intestinal cells, again, to prevent bacteria and bacterial products from translocating and getting through those intestinal tight junctions. It can reduce the pH in the colon when these short-chain fatty acids are produced, and that reduces the growth of pathogen. And these short-chain fatty acids can also trigger the release of satiety hormones, so hormones that will increase the feelings of fullness. Now, we know that things also could compromise the gut microbiota. Dietary fiber is a great fuel for the gut microbiota, but other things in diet might cause dysbiosis or less diversity. And some of these include a low-fiber diet, a diet that's high in saturated fats. Sugars have been shown to compromise that. There are certain emulsifiers that are used in processed foods that have been shown to cause disruption in the profiles of these microbiota, and some artificial sweeteners. And again, in this one, it's a very interesting topic. There seems to be responders and non-responders, and perhaps in part due to their baseline gut microbiota. So in terms of moving away from just looking strictly at dietary components, are there other factors that can influence the gut microbiota? And here we have this whole field of biotics, probiotics, prebiotics, symbiotics, and you may have heard the newest term, postbiotics. So all of these have been given a very clear definition by ISAP, which is the International Scientific Association for Probiotics and Prebiotics. And I've given you also the references there for some excellent consensus statements. So each of these papers goes through and gives the definition, the information around, are these, do they have efficacy? What's the safety around them? What are some regulatory considerations around these terms and around these products? So I think it's important that we use and know these definitions and use the terms correctly. So probiotic, of course, is the live microorganisms. When administered in adequate amounts, confer a health benefit on the host. Prebiotic is a substrate that is selectively utilized by host microorganisms and confers a health benefit. The symbiotic is what we traditionally think of the blend of a mixture of prebiotic and probiotic, but the definition is a mixture comprising live microorganisms and substrates, selectively utilized by the host microorganisms, again conferring a health benefit. And then the postbiotic, so this newer term really is the microorganisms that are no longer alive. So to be a probiotic, it has to be a live microorganism. Here we're talking about ones that have maybe died off in a product, or a product that is specifically made with heat-killed bacteria. So this is a preparation of inanimate microorganisms and or their components. Again, the key thing to all of these definitions, it has to have proved to confer a health benefit on the host. So I'll leave those references with you there to look up later. So if I'm going to focus a little bit on prebiotic here and some of the key components of that definition that the consensus team came up with, that it has to be a substrate. So it really means that it's food for the microorganism, and it's therefore not digested by the human host. And the microbiota is going to ferment this substance and obtain nourishment from it. The next part of it has to be selectively utilized by the host microorganisms. So it means that specific microorganisms will utilize this substance and increase in abundance. And one of those that selectively uses prebiotic is bifidobacteria. And again, recalling back how critical that bifidobacteria is in terms of the immune system and other actions. So selective feeding, and then it should confer a health benefit. And you can see across all those definitions, probiotic, prebiotic, etc. This is really important, and it has to be demonstrated through clinical research. And it really has to be linked to a specific health benefit in the host. So this is just a description of some of the things that are prebiotic and some of the things that are not prebiotic. And this is again described in the prebiotic consensus statement, but there are many substances that affect the microbiome. The ones that are not prebiotic, some are very obvious to us. So antibiotics affect the microbiome, but they're not prebiotic. Probiotics, proteins, fats, vitamins, all can affect the microbiome, but would not fit the definition of prebiotic. Things that are proven to be prebiotic are the fructans. So inulin is a chicory root derived fructan, and galactans. And on the right there you can see the proven prebiotics: inulin, fructooligosaccharides, and galactooligosaccharides. And then we have things that are likely prebiotic, but they don't quite have sufficient body of evidence right now to completely fit into that definition, but they could be there. So we call them candidate prebiotics. So resistant starch, polydextrose, the xylooligosaccharides, mannooligosaccharides, you can see human milk oligosaccharides, beta-glucan, pectin. So these are candidate prebiotics, and could one day have sufficient evidence to be put into that proven prebiotic category. And then we have the dietary fiber in the middle there. And I think it's really important that we don't call all dietary fiber prebiotic fiber, because it's not. Prebiotic is a very specific definition of a type of dietary fiber. The fermentable dietary fibers, some of them can be prebiotics. The less fermentable tend to not be prebiotics. So hopefully this picture here helps to define what is prebiotic, what is not prebiotic. So there's a lot of potential for prebiotics because of their selective effect on the gut microbiota for health benefits. And clinical studies and systematic reviews that have, taken a look at a collective of clinical studies have really demonstrated the potential for prebiotics to benefit numerous aspects of health. So we see very clearly that it can affect the intestinal microbiota. Most clearly is an increase in bifidobacteria. There's lots of studies looking at blood lipids, so can it help with reduction of triglycerides, blood glucose regulation, mineral absorption, particularly calcium, constipation, inflammation. There's studies looking at weight loss and specifically body fat reduction. And then mood disorders have also been examined. So what I'd like to do is just highlight a few of these instances or indications where prebiotics have been used. So first one is what we know, we had a large cohort, pregnancy cohort, where we wanted to really look at the effect of antibiotics on the infant and their risk of developing, in this case specifically, obesity. But we know that antibiotics given during labor or during pregnancy or early infancy can increase the risk of obesity, asthma, allergies, etc. And so in this large pregnancy cohort, what we saw was that antibiotics that were given just during labor were associated with higher Z-BMI score in infants at 1 year of age. And so this led us then to be very interested in, is there a way to protect against this increased risk of obesity? Because we know that sometimes antibiotics have to be given. And so in those instances, can we rescue the microbiome of these infants? And so this is a study we did. It's preclinical. We haven't moved to the clinical study yet. But in rats, we were able to show that if we gave the mother rat a prebiotic fiber during the latter part of her pregnancy and then through lactation, that we could attenuate or we could reduce this risk of developing obesity because of the early exposure to antibiotics. So that gives us hope that maybe there are things we can do in humans, in human pregnancy, that can mitigate some of these risks when antibiotics have to be given. So moving from pregnancy into childhood, we were very interested to see if we could use prebiotic fiber to help children. So this is a study with 7 to 12-year-olds. If we try and increase the bifidobacteria, this healthy bacteria, can we help with weight management in these 7 to 12-year-old children? So we had a placebo group and a group given the prebiotic fiber, and it was over 4 months that we gave them this. And then we looked at their change in their percent body fat, and we were very interested in the trunk fat, specifically, so central body fat. And what we could see was that there was a significant decrease in trunk fat in the children who had taken the prebiotic fiber supplement. Once a day, 8 grams per day of the prebiotic fiber compared to the placebo group. And we could see that there was a significant increase in how the abundance of their bifidobacteria. So that second graph there, the relative abundance percent, you can see the blue graph the bar that goes up is the prebiotics. So we definitely increased their bifidobacteria selectively with this prebiotic. And the most interesting, I think, thing that we saw for this study was that in the placebo group, these children, they were all growing, of course, they're between 7 and 12 years of age, but they were projected, if you took their 4-month weight gain, projected that over a year, they would almost triple what was expected yearly increase in body weight for this age group of children. So far in excess of what their rate of weight gain should be. Whereas this prebiotic group, these children, their weight gain was normalized. So they didn't have, we didn't correct, we didn't reverse their overweight and obesity status, but we normalized their rate of growth. And so you could think that perhaps if we would, do this longer than 4 months, this could be a way for them to not continue to increase in the weight percentiles. We then were also very interested in adulthood So in this instance, we had a higher dose. This was very early study, one of the earliest studies that was done with the prebiotic fiber in looking at weight management in adults. And so we gave a fairly high dose. We admit that now. It's 21 grams per day was a high dose. We didn't have too many dropouts, though, so that's a good thing. And we tested the effects of this particular oligofructose, is what we chose for this study, on metabolic health, and the adults had overweight or obesity. And this study we did for 3 months, placebo or prebiotic. So the placebo group, you can see there was a small amount of weight gain, about a half a kilogram, fairly typical kind of adult weight gain that we can experience. But the prebiotic group actually lost a kilogram of body weight. And again, we did not correct the overweight or obesity, but certainly some of the additional metabolic outcomes that we looked at are meaningful. So first of all, you see the decrease in body weight. The next part there is the lean mass, so we were able to preserve their lean mass. And then the fat mass is the critical one. And again, it was trunk fat, where central abdominal fat, where most of the weight loss occurred there. The other thing we were very interested to look at, is there any effect on intestinal permeability or this barrier? Could we enhance their barrier so that they don't have bacteria or bacterial products, endotoxins leaking through the gut, which has been directly linked to triggering insulin resistance. So bacterial products, particularly LPS, lipopolysaccharide, it's an endotoxin coming from bacteria as they die off in our gut, and that's what leaks through and gets into the bloodstream. And this can cause this low-grade inflammation that we talk about, and very prevalent in obesity. And what we saw with the oligofructose, the prebiotic fiber, was that there was a significant reduction in LPS in the bloodstream compared to the placebo, which had a slight increase in there. So lastly, I want to just talk to you briefly about a study we just concluded, and that's osteoarthritis. So there is a 60% lifetime risk of developing knee osteoarthritis if an individual has with obesity. And if you have just a 5 kilogram weight loss over 10 years, that can decrease the risk of osteoarthritis by 50%. So we know there's a tight link between obesity and osteoarthritis. And traditionally, arthritis was thought to be due to biomechanical overload, so wear and tear on the joints, and that's what caused you to get the knee osteoarthritis. But now we recognize that this is an inflammatory process, and that inflammation, particularly in obesity, this low-grade inflammation, can be a trigger and can really contribute to osteoarthritis. And so what we have is this, you hear a lot about the gut-brain axis. That makes sense to us now, but now there's a gut-joint axis. So you have to think, well, how can something happening in the gut have any effect whatsoever that's going on in the joints of my knee or the joints of my shoulder, etc.? And it comes back to this intestinal barrier. So if you have the compromised intestinal barrier, so the mucus layer that's supposed to be sitting on top of those intestinal villi, if that mucus layer gets too thin or it gets compromised by poor diet, or if those tight junctions, the lightning bolts that I have between those cells, if those are not firmly in place and functioning as they should, things like the endotoxin can leak through the intestinal barrier. And those products can then circulate throughout the body. And some of these microbial metabolites can interact at the level of the joint and cause inflammation, and inflammation within that local knee joint can cause degeneration and pain, and the immune cells can come in and accentuate that effect. So what about prebiotics? How could something that is selectively fueling a particular type of gut bacteria work on the knee joint? Well, again, you have some of these beneficial microbial metabolites, like those short-chain fatty acids, that could interact, decrease the pro-inflammatory cytokines, and enhance, reduce inflammation and pain, and maybe allow these individuals to exercise or walk or whatever. So we conducted a study in prebiotics for osteoarthritis, and we really wanted to test the effect of a prebiotic supplement on physical function and pain in adults who had both knee osteoarthritis and obesity. So the individuals were 30 to 75 years of age. We gave them a 16 gram per day. This time we used the blend, oligofructose enriched inulin blend, and they took the prebiotic or the placebo for 6 months. And before and after the supplementation period, we did a battery of tests that are very commonly used in the orthopedic world to test how good are your knee joints functioning. How good can you do the activities of daily living? And so what we saw was that over 6 months, the participants who received the prebiotic had improved performance on multiple of these different tests of daily living. And in addition, they reported to us that they had less knee pain. So subjectively, they said we have less knee pain. And we did a DEXA scan and showed they had less trunk fat. So some of those tests, one of them was a 40-meter fast-paced walk test. So you start, you walk 40 meters, and you do that as fast as you can. So they improved on that test. The time up and go, so one of the limiting factors with knee arthritis is it really impacts your mobility. And when your mobility is impacted, you have less ability to go out and walk, to exercise, these kind of things. And so obesity becomes easier. Gaining weight becomes easier. So in this instance, it was the time up and go test, so getting up out of a chair and then walking a path, and do that over and over again. So they could do that better after the prebiotic. Hand grip strength, so very interesting that their ability to use one of the hand grip dynamometers, they had increased hand grip strength, and we saw a very clear correlation between what is your hand grip strength and bifidobacteria. So for whatever the relationship is there, increasing bifidobacteria is linked to better hand grip strength. And then a 6-minute walk test. So just 6 minutes, walk as far as you can, and they had increase in that. So prebiotics for the gut-brain axis, just to end off with a few forward-looking areas for prebiotics. Of course, gut-brain mental health is a very important consideration today. And what we know that birth by C-section increases the risk for developing metabolic disorders, obesity, and neurodevelopmental disorders. And so in this particular study, it was across over 20 million deliveries. They saw that there was an increased odds of autism spectrum disorder and attention deficit hyperactivity disorder with C-section. So the question becomes, is there potential for prebiotics in early life to attenuate some of these neurodevelopmental disorders? So if we look to systematic reviews where they take all of the collective evidence to date, There was one on probiotics, prebiotics, and symbiotics, and it showed that it resulted in beneficial changes to the gut microbiota in newborns who were delivered by C-section, bringing them closer to vaginally delivered newborns, particularly that bifidobacterium. So we know that the bifidobacterium can be brought closer to what you would see in a vaginally delivered newborn, but the remaining question is, does it affect behavior? So that's the key question that still has to be answered. And right now, what the state of this evidence is still really in animal studies. One study in mice, they took a prebiotic blend, or they took a probiotic, so a prebiotic versus a probiotic intervention here. And they gave that to the mother and the offspring. And what they could see, yes, if we take those mice and they're born by C-section, we can get them back to a healthier bifidobacteria status. And then the question is, so does that also affect then behavior? So very early in the young mouse life, they could see that the prebiotic mixture prevented some of the communication deficits that you might see. So communication, again, a key symptom or part of autism spectrum. So in the mouse equivalent, they saw some benefit there. And then there's some other tests they can do with these mice to look at their memory and their social interactions. So again, some key factors that if we think forward to children with autism, the social interaction is a big one there. And what they could see is that the prebiotic, more so than the probiotic, could correct some of these deficits that they saw with the C-section birth. So looking forward, again, I will say the state of this is, a lot of this is preclinical studies, but gives us a window to what might be seen in clinical studies and eventually get into practice. The study I just talked about, they fed the prebiotic mixture to both the mother and the offspring. So the question is, what if because C-sections are not always planned, obviously. So sometimes you can't get in there and give mom the prebiotic, so is there the potential to just give the offspring the prebiotic and maybe improve sociability, reduce anxiety-like behavior, so a kind of a rescue intervention, and many other potential scenarios for which prebiotics might be beneficial. And the bottom example there was really combining an HMO, so combine a candidate prebiotic with a proven prebiotic, and of course you might have the best outcomes that way. So on the horizon in clinical trials, I just wanted to give you a listing here. I'm not going to read through them all. If you go into the clinical trials registry, clinicaltrials.gov, right now with prebiotics, there's 129 different trials that are either planned or ongoing. And you can see the variety of different conditions in children and in adults where there is the potential for prebiotics to be of benefit and are being tested clinically, so we have the scientific evidence for them. And so what can we recommend? What can we do as health professionals? So again, some of this is still in research state, but there's definitely things we can do in terms of our gut microbiota already. So definitely we should encourage individuals to consume a variety of foods that contain dietary fiber in general and prebiotic fiber specifically. So on the slide here you have some of the foods that are richest in prebiotic fiber. And of course the richest is right down there at the bottom, the chicory root, where the inulin can be extracted from, but we don't eat chicory root naturally just at the grocery store. But some of these other foods are more common sources of food prebiotics. And it's very interesting that the Western diet would probably, just thinking of the foods here on this, would give you between 1 and 4 grams per day is what you would probably consume. And there's been studies, research studies, where they look at all the different foods and they rank them on their prebiotic fiber content and which ones are contributing most to the diet of North Americans. And wheat actually, so wheat bread products, comes up as 78% of the prebiotic fiber that we are getting in our diet is coming from wheat. And it's not that wheat has huge amounts of it, it's just that we eat a lot of bread products and grain products. So that's why it rises to the top of that list there. And about 10% from onions, it came up in that study. So there's some of the foods you can get more prebiotic fiber from than others. But sometimes supplementation may be indicated. So for certain populations or health conditions, supplementation may be warranted. And so the doses that have been used in research studies range anywhere from 3 to 21 grams per day. Most commonly, if you're looking at a metabolic condition or something, it's 15 to 16 grams per day is what the research studies would be testing. Supplementation could also help to fill the dietary fiber gap. So we know that in the US, only about 4% of adults meet the adequate intake. So there's lots of room to help find different ways for us to fill that dietary fiber gap. With the FDA, they are an accepted dietary fiber, so there's some structure function claims that can be made with the prebiotics. And in the European Food and Safety Authority, they already have a health claim in terms of constipation. So chicory inulin contributes to maintenance of normal defecation by increasing stool frequency, and there it's at least a 12 gram per day. So that is a health claim that is approved there. So in conclusion, I hope I've convinced you that the gut microbiota plays an important role in health and disease, and that establishing a healthy microbiota in early life is very critical. And I'm just going to say one thing on that in closing here. Sometimes, with antibiotics or early life changes, the insult happens, and then we see that the gut microbiota kind of goes back to a normal function. But some of those lasting impacts happen because the microbiome was disrupted at a very short period of time, and even if it normalizes later on, that disturbance may have programmed something in the immune system or may have programmed something in the metabolic system. So we really, really want to focus on that early life and making sure it's as healthy as possible. Feed your microbiota throughout life with dietary fibers that promote health. Prebiotics will target the beneficial bacteria in the gut, and we should get prebiotics in the day in addition to all the other dietary fibers. And I think there's promising evidence for prebiotics in management of multiple conditions. And my slogan in life is a happy gut, happy life. So thank you. And I think we have time for questions before the exhibit hall. Go ahead.
I have a bunch of questions, but I'll try to limit it. Also some observations. So I'm a clinical dietitian, so I have a lot of patients who have mucus in their stool. And I'm wondering if you have any biotics that help, obviously that's a disruption of the mucus barrier. And I noticed that some of my tube feeding formulas now have inulin. Is that going to protect the mucus barrier, or can I treat the mucousy stool with inulin?
So one thing that we have seen with the prebiotics, so first off with the mucus, so we want the ideal amount of mucus in the barrier. Some conditions and diets decrease that mucus barrier, which is dangerous, and some overproduce the mucus. So the bacteria that we have, again, you want to optimize them so that that mucus barrier is not too big and you're losing mucus, and or too thin and gone, and allowing bacteria to interact with the intestine. So the bacteria and the mucus is an important relationship. What they have seen with the prebiotic fibers is that you just need a low dose to actually enhance that intestinal barrier and correct mucus, whereas you probably need a higher dose if you want to start tackling or impacting on some of the metabolic conditions. So again, as low as like 3 grams, which really shouldn't cause too much of any kind of GI side effect in a person, that they can improve that intestinal barrier. Whereas if we're thinking about obesity, weight management, like some of the studies we've done, that's when you have to get to the higher dose. So lower dose.
Thank you. One other quick thing. I have 2 kids who are C-sections, but one of the things they're doing now with C-sections, they're slathering the kid's face with vaginal secretions. Does that fix the problem?
So that's there is now some research evaluating what does that practice do to try and mimic passing through the vaginal tract, the birth canal. And the studies show that you can get them closer back to a regular vaginal delivery, but some of the studies suggest that it's not as lasting. So you can start to get the profile closer to the normal natural birth, but whether or not all of the effects of, sometimes birth is a long process. So, 18 hours of exposure versus the more limited time exposure. So there can be differences there, but it's being looked at in the research world to see, is this a good practice? Is it a safe practice?
Right.
And do the effects last? That's the key thing, is we've seen some changes in the microbiota, but is this going to last and be protective?
Thank you.
Yeah.
Hi there. I have a few questions, but one, someone told me once about a supplement that was from breast milk to help boost immunity, like when they would go on an airplane. And I don't remember what the supplement was called, but just like what you think about breast milk supplements and how they would help even adults. So I'm not quite, our colostrum, early milk, is that, or are you, I'm not sure what supplement that person would have been taking breast milk that's donated, dehydrating it, and making it into a supplement.
So likely, I'm just guessing here what the supplement might be, but if it was colostrum, which is the very first early milk, is incredibly immune rich. So this is the infant who is born with a very naive immune system that needs to be trained by bacteria, but also by immune factors within mom's breast milk. So colostrum is the very first milk that's produced and incredibly rich. So I'm suspecting it might be that. I mean, you can also see colostrum supplements taken from bovine, from cow, and put into, protein powders and that kind of stuff with, we won't talk about what's the evidence around that, but that's my suspicion, is it's probably colostrum, and it is indeed very rich in immune factors.
Okay. My other question is, from somebody who recommends probiotics and prebiotics and sees like the weight loss benefits, how long would you recommend someone supplement with probiotics? I know like a line has like 30 to 60 days. You're getting it in your diet if you're eating a healthy, balanced diet. But how long would you recommend somebody who maybe is probiotic deficient, how long would they be on that supplement?
So the key thing that we know with probiotics and prebiotics is that once you stop taking them, your microbiome is going to revert back to what it was. So, and that's a pretty quick turnaround. So 2 to 3 to 4 weeks, the benefit you got from that, so if it's prebiotics, so that increase in bifidobacteria, it's not now a permanent change in your gut microbiota. If you stop the prebiotics, same thing with probiotics, if you stop them, you tend to revert back. And that goes back to this concept that we have a stable gut microbiota. So it does want to come back to what it was. So you have to keep taking them. Yeah.
Hi, could you comment for people who have IBS? We just listened to a talk earlier about the FODMAP diet, but so many of those prebiotic-rich foods are the ones that our patients cannot handle because of that. So is that the role for the supplements? Could you comment?
Yeah, so for the supplement, and again, I think dosing is a really important consideration here. So if we think about example I gave with the gut barrier, which is really critical for so many conditions, and we want to have that intestinal barrier as strong, as an intact and functional as possible, you need a very low dose of a prebiotic to start to see some of those impacts. So I think dosing is important there. And also just, determining, is it, the inulin or the FOS or the GOS? I mean, there's different proven prebiotics that an individual could try as well to see which is more tolerated. Yeah.
Hi. I just have a question about kombucha.
Mm-hmm. Yes.
What is your thinking about kombucha? Does it really help? And if it does help, how much are we supposed to be drinking? I mean, it is so popular. It's everywhere. It's in the grocery store. What are your thoughts on it?
So thank you for bringing that up, because there's those 4 consensus statements that I talked to you about. The 5th one is on fermented foods. So there's an excellent overview of fermented foods, and kombucha falls under the fermented foods, same as would kimchi, tempeh. There's lots of, and most yogurts are fermented. So this is a hot area in the food world, and particularly with microbiome, because these fermented foods are made with bacterial cultures, which is what gives each of them their specific flavors, composition, etc. So with the kombucha and with many of the sauerkrauts included in there too, a lot of these are going to fall into that postbiotic. So a lot of the bacteria were obviously alive when they made the product, and then they slowly tend to die off in the product. So you are getting microbial exposure, which is, as we heard today, very good for us. We want exposure to many different types of microbes. So they do tend to be dead microbes, particularly if that product has been heated. So good for us. As far as giving you a recommendation on how many cups a day, I don't have that, but definitely they fall under this new fermented food area and contributes to our microbial exposure, which is good, yeah.
On that topic of fermented foods, because there's a lot of discussion not only about the importance of including fermented foods, but there are some fermented foods that are cooked, like sourdough bread. So when you're comparing products like that, or a canned sauerkraut versus a raw sauerkraut, shouldn't we be explaining the differences to our consumers and patients about how these foods are being processed? And also, you didn't talk about adding, like some products have added inulin, like yogurts now have inulin added. And is that as good, again, as, taking it in a different as in a more natural way?
Yes, so we'll start with that one first. So, inulin into, and you have the list on your table there of some other products where the inulin is put in. Absolutely, and I think that's, again, one way when we think about this dietary fiber gap. We need to have a variety of ways that individuals can meet their fiber intake, and if there's, 2 grams in a granola bar, that would contribute, or in a yogurt. So yes, finding it in different foods is good and contributes the same as if you took it in a supplement form and mixed it in water. For the fermented foods, should we be describing to our clients or to consumers that there's differences between heated and non-heat treated? And I guess you have to judge the level of interest or for whoever you're talking to about that. So yes, if we want to get the live microbes in these fermented foods, then we need to be, for instance, kimchi. It needs to be the kimchi that's stored in the refrigerator section of the store. Or the sauerkraut, if you want the live microbes in that fermented food, it has to be the refrigerated version and not the version that's canned and sitting on the grocery store shelf. So there's a difference there. The key thing is there a difference in the health benefit between the non-heat treated and the heat treated? And that's where, again, we get into this postbiotic, because there is still value in a dead bacteria. Just the exposure to those parts of the bacteria or the metabolites, the byproducts they put into the sauerkraut before they died off, those are also of benefit to us. So yes, if we could, we would like to buy the non-heat treated, the refrigerated version, but fermented foods, more fermented foods, is going to be of benefit, and so we should get a variety of those fermented foods. Thank you very much, and I'll stay up here. I know there's a couple other questions, so thank you very much.